Thank you for inviting us on your show again, Jenny. This week, we've been handling the fallout from some really devastating news for our local and national NHS. We've just discovered that 13 North East London GP surgeries have been taken over by Operose Health, which is a UK subsidiary of the US health insurance giant, the Centene Corporation. The surgeries affected are in Tower Hamlets, Whitechapel Health Centre in Hessel Street, and the Port Soken branch in Somerset Street, as well as East One Health, which has branches in Dean Cross Street and Cable Street. In Newham, the Albert Road and Britannia Village surgeries in Woolwich, St Luke's in Canning Town, the Carpenters practice in Stratford, Lucas Avenue practice in Upton Park, and Church Road in Manor Park. In Hackney, the Trowbridge surgery in Hackney Wick, in Barking, Victoria Medical Centre, and in Redbridge, the Logsford practice in Ilford. In all, Operose have taken over 49 sites under 37 contracts across London and South East England. This is going to affect 390,000 patients. And added to the 21 surgeries they already own around the country, this almost certainly leaves the Centene Corporation as the biggest provider of GP services in the English NHS. So why does it matter? People sometimes ask us what's the difference, given that all GP practices are independent businesses working on contract to the NHS. Well, there's every difference in the world. GP partners running a surgery for decades have a commitment to their patients, families, and local areas. A US health corporation with a 5 or 10-year contract has a commitment to profits. On a traditional family doctor contract, GPs are subcontracted to the NHS. They aren't true businesses because there are strict controls on how they spend their money. Practice staff have more or less nationally agreed pay and conditions, as well as NHS pensions. But when new alternative provider contracts were introduced in 2004, all that changed. GPs and private companies were offered the chance to run some surgeries differently. On these 5 or 10-year contracts, they were offered extra funding, encouraged to form chains, and allowed to make profits for shareholders. In practice, the first of these alternative provider contracts were taken on by GP partners who swapped contracts to try out the new model. But now we're seeing the chains they built being hoovered up by the insurance giants. It matters because private companies have a poor record of running practices. For example, when another US giant, United Health, outbid GPs to take on 3 practices in Camden in 2008, patient services were poor, and the company ended up selling them off before the end of the contract because they weren't seen as profitable enough. It led to one long-standing practice failing altogether, leaving 4,700 patients without a GP. It matters because since they can't up their prices, these companies can only increase their profits by cutting back on staff costs and services. And it matters because the Centene Corporation has a poor reputation elsewhere. In the States, the company is currently slashing jobs and getting bad press for its running of services in Texas and Iowa. We've heard anecdotally that the model of big companies like this is to reduce the number of doctors in favour of lesser trained physicians associates and nurse practitioners. Don't get me wrong, these are important health workers, but they're not a substitute for GPs. It also matters because Operose Health is now so big in primary care that they have the power to demand plum seats on the very NHS bodies that decide which services to commission and who to give contracts to. And it matters because via another UK subsidiary, Centene also owns 40% of Circle Health, which in turn owns the huge chain of BMI hospitals, which all make a significant amount of their income from treating NHS patients. That includes, by the way, the BMI London Independent in Whitechapel. So how did this happen? There is now an unholy row breaking out across London, with councillors, health campaigners and GPs across the area all demanding to know how the takeover was allowed to happen. The 49 sites, including our 13 surgeries, were previously set up and run mainly on alternative provider contracts by a small group of GPs who set up a company called AT Medics. In the autumn of 2019, 75% of AT Medics shares seem to have been transferred to a new company. This would later allow them to be passed on to Centene subsidiaries, which effectively merged the two companies. But primary care commissioning committees in 13 areas had awarded contracts for the running of these surgeries in good faith to a company led by GPs. Passing on the contracts to a US health corp was always going to be controversial. Our commissioners could have said no. So when AT Medics applied for permission, they stressed that their company would still carry responsibility. The same staff would run the surgeries, and the current directors would remain actively involved. We're still piecing together why this was enough, but every one of the committees, at least one via chair's action, gave permission. And so far we haven't seen any evidence of proper investigation or even a debate among committee members. Operose being owned by Centene doesn't even seem to have been mentioned. What happened next was breathtaking. When the last permission was granted on the 9th of February, Operose simply took over the surgeries. On the 10th of February, the AT Medics directors resigned en masse, replaced by 3 Centene directors. It was now a done deal. This story is going to run and run because a lot of people are very angry. But just to underline another important point, so much for the NHS White Paper revealed on the 11th of February, which claims that the government's plan is to row back on privatisation. The transformation they say they are planning is actually already well advanced, and Centene, Operose, United Health, Optum et al. Are absolutely the direction of travel.